California's Gold is produced in association with KCET Los Angeles and is seen statewide on California Public Television. This series is endorsed by the California Teachers Association, the California School Boards Association, and the California Library Association.
Well, hello everybody. I'm Huell, and to be honest with you, these days I'm feeling a little poorly. In fact, for the last couple of weeks, I've had this cough. I think I've got pneumonia. I'm really not feeling good at all, and to top things off, a couple of days ago, I got shot in the head. So I need to find me a doctor. And more than that, I really need to check myself into a hospital. And thank goodness I'm in luck, because I've come here to Sutter's Fort State Historic Park here in Sacramento, and I found what they tell me is a hospital, and there over there is you're a doctor?
Dr. Henry Plummer.
Yeah, he's a doctor, and the only catch is, in order for me to visit that hospital and spend time with that doctor, we've got to go back in time to 1850, to Gold Rush, California, which from all accounts was kind of sketchy as far as the medical profession was concerned. But we got to do what we got to do, so we're going to head over to the hospital, meet up with the doctor, and hopefully have a good experience, and along the way, find a little bit of California's gold. Okay, that kind of sets it up. Come on over here, fellas. I'm feeling a little poorly. I don't have my usual enthusiasm today.
Very concerned about your health, Huell.
Your name, sir?
Bob Russo. Bob Russo from Sutter's Fort State Historic Park.
Yes, sir.
And I'm Steve Beck, and gold miners would have been comrades, and we don't want you to go without some medical attention.
No, I need it. I'm bleeding profusely from the head, and I've got this cough. But I've come to a very historic place to find help, haven't I?
Yes, you have. This has been a hospital since 1840. There's been a doctor located on the grounds. At times, it served a hospital for the entire Sacramento area, and even today, Sutter General Hospital is located across the street from here.
That's Sutter Hospital, today's Sutter Hospital, right over there. But historically, there would have been a little hospital set up right here in this corner of Sutter's Fort, going all the way back to 1840, so it was here 10 years before the gold rush.
Even 10 years before the gold rush. In 1849, they moved the hospital into the Bastion, the cannon tower there. Miners complained because it was a $16 a day stay to stay in that hospital.
Always been expensive to stay in a hospital, but I need to go to a hospital. I need a doctor's attention.
And I hope we can get you into the hospital before we encounter any interlopers on the way, because there might be some people pretending to be doctors.
See, not everybody in California that claims to be a doctor is really a doctor. Some of them just have degrees from Eastern universities written in Latin, and no one really knows what they say. So we'll try to get by those and get you into people that can help you.
What percentage of the people who claimed to be doctors back then do you think really were doctors?
Well, let's just say we know all the real doctors. We can document them. So, and there's very few of them. So anybody else would be impossible to tell you.
So the chances are, when you went to see a doctor during the gold rush in California, you were not really seeing a real doctor.
That's, yeah.
You're not giving me much hope.
If you could say femur, you were a doctor.
So this guy's beginning to look suspicious, but I want to hook up with him. Your name, sir, is?
Dr. Henry Plummer, Huell.
Okay, now
I'm the well-known drummer and procurer of pharmaceuticals.
Now you represent what in the gold rush? Who are you representing today?
Well, I'm representing kind of the charlatans, the people who sold they were called snake oils in those days.
Snake oil salesman.
Right.
And is this the snake oil right here?
This is, most of what you see are not really medications. They're mainly alcohol with some flavoring in them. Some of them had some fact behind them. Some of them had herbs and home remedies.
Well,
that you
I'm
might have
feeling
found.
poorly. What have you
Well,
got
you
here
don't
for
look
me?
too well, but I have something that'll cure that. We have today Kickapoo Indian oil. Now, Kickapoo Indian oil is the cure-all of the 19th century. This drug will cure arthritis, neuritis, neuralgia, pain of the upper and lower intestines. It'll cure dyspepsia. You even put it on a gunshot wound and it'll make it feel better.
I need to put,
I'll
I've got a
tell you what,
gunshot wound right up
we'll
here.
give you just a little dram of this here, and you'll be good for a fortnight. There you go.
He really poured this out for me to... Should I be drinking this?
Oh, perfectly harmless. I drink it myself.
Probably just a mixture of opiate and alcohol.
Yeah.
What do you mean, opiate and alcohol?
Opiate and alcohol. It was called laudanum. It was a common pharmaceutical on the trail and the primary ingredient given out by charlatans.
Was opium and alcohol?
An opiate, so like,
Opiate.
yeah, so a poppy derivative.
Oh my.
So you're not going to want to drink it all the time, but probably one shot won't hurt you.
You may want to drink it all the time. Is the problem.
This
I
is,
drink it myself. It doesn't harm a bit.
so he really poured me some here.
It's
do
guaranteed
I-
to work.
Do
Well,
I shoot it?
If this doesn't work, you bring it back, and I guarantee I'll give you your money back if you can find me here.
If it doesn't kill me. You know what, Doc? I'm feeling better already.
You're looking better. Some color comes back into your
I'm
face.
definitely getting color to my face. Wait a minute. What does this say?
This is Cannon Brand Cure for Constipation.
Oh.
And we like to say that Cannon Brand will blow the obstruction away. The symbolism on the label, of course, is obvious.
Oh my God.
And it'll make you run free and clear once more.
Now, would you travel throughout the gold country?
Had to keep traveling because usually the law was right on the heels.
Because you're not a real doctor.
Not at all. I read a book once on medicine.
Oh, well, that's probably all it took to call yourself a doctor
That's
back
it.
then. Look at this. Let's get one more look at this because I'm going to pass by the thing for constipation if you don't mind. Don't take that personally, but
Well, how about dense toothache rum? I drink this myself, and I haven't had a toothache that I know of in years.
dense toothache rum.
Yeah. That gives you an idea of what the ingredients might be.
Rum.
Mm-hmm.
Okay, now we're moving on. We're reaching another level here, Steve. We're moving from me hanging out with the, what do you call that guy over
I would call him a snake oil salesman. A charlatan be nice too.
All right, we're moving into, actually, this would have been a formal hospital back in the gold rush days.
This would have been the overflow when they had to set up wall tents because there were too many people in the enclosed structure of the bastion at Sutter's Fort, and so it provides a little more protection than this open air tent.
And this could have been what they used out in the countryside, out in the hinterland.
Certainly would have been. This would have been a MASH unit.
All right, let's walk inside. I'm not sure. Look at this. What is going on over here?
I'm cupping this young man, sir.
Cupping him. What does that mean?
Well, it removes the evil vapors that the body has accumulated.
You heat it up. How did that work?
You heat up the small cups
Uh-huh.
until they're very hot, and they'll suck the vapors from his body.
The vapors from his body.
Yes, sir.
Now, I need help myself. Can you divert your attention over this way just a little bit?
Well, would you mind if I put a small poultice on him, and then, since we're very he needs to be treated quickly,
Okay.
and then I'll talk to you.
I have no idea. I didn't know I was going to observe all of this going on. What are you doing here?
Well, I have a
Look over here.
I have a mustard poultice, sir.
This is made of mustard.
Mustard and some flour and a little bit of oatmeal to thicken it up a little bit.
Oatmeal.
A little bit.
And you're just going to put this on?
On his chest wall.
Oh my gosh.
Burns.
Well,
You're burning the boy.
that's the job it's supposed to do, sir. That's the job it's supposed to do.
So these are called what?
This is a mustard poultice, sir.
A mustard poultice.
Or a
It's
catabolism.
poultice. Poultice.
Poultice.
Poultice.
Now you said you were feeling poorly, sir.
I'm feeling very poorly.
May I shake your hand, sir? It's nice to meet you. My name is Mrs. Kelsey, and I see that you have some arthritis in your hand, sir.
I'm not here for arthritis. I'm here for a gunshot wound to the head and for pneumonia.
Well, unfortunately, I could probably treat you with the cupping and the mustard poultice, but I think we need to do something about this arthritis in your hand, sir.
Are you a doctor?
I'm a midwife, sir.
I don't need a midwife.
And an
I need a doctor.
Well, I think you should come out with me over here, and I'll create you a small poultice.
I'm following you. I'm not sure what we're doing. Oh my gosh, look in here. What is this you've got in the pot there?
Well, I've got a sage and vinegar poultice that
Oh, it smells good.
It does smell good, and it works very nicely. Why don't you give me your hand?
You're going to put this on me.
Yes, sir. Now, doesn't that
You
feel
didn't
good?
tell me this was going to happen. She's actually... Oh my gosh. It's warm. It's wet.
Well, that was what it was meant to be, sir.
So-
Warm and wet.
They really use these things?
Of course. This would have been the type of medicine you would have known about because you grew up with it. Things that your mom did, things that your aunt and grandmother did. This would have been the type of medicine you would have turned to cure yourself if you had the knowledge. But see, the young men that were out here, like most young men, they probably didn't remember all of this.
Yeah, well, they didn't know how to treat themselves.
Exactly. So there would have been people like this that would have been able to, at least they would have trusted these types of remedies.
So this whole thing, this is kind of like something that women would have known how to do.
It would have been passed down from your mother to your daughter to your granddaughter.
But now you've got a whole thing of, it looks like bottles of things over there.
I've got herbs, and I've got oils, and I've got vinegars, and I've got all the appropriate things that I might need to treat some minor illnesses here. I have a list here of the illnesses that I can treat. I can treat the ague because I do have some quinine.
Treat the what?
The ague.
The ague.
Yes, sir. That's having chills and fevers, and it comes on all the time.
I've got that. I've got that. I thought it was pneumonia. It was the ague instead.
It could be the ague, sir. I haven't listened to your lungs.
Can you do that?
Well, I would have to have you turn around and let me listen.
What's she doing?
Take a deep breath. Other side. I don't think you have pneumonia, sir. I think you have, there's no consolidation that I can hear in your lungs.
So I've got arthritis.
You've got some arthritis, sir, but I think you may have actually had the ague.
Okay, now we've come into the dining hall here at Sutter's Fort, which has obviously been turned into an operating room. We got a patient laid out here. What's getting ready to happen here?
Well, this young lady needs to have her hand amputated.
And are you a doctor? Can you do this legally?
Legally? Well, I would be either a midwife or a nurse or maybe the female family member of a doctor, but I would not have been a formally certified surgeon yet.
But you could do this.
I could do it if anybody would let me.
Okay, well, obviously she's ready. She's
Yes.
biting down on the leather there.
Biting down on the leather because we don't want her to bite through her own cheek or her own tongue from the pain.
No ether, no way to put her out.
No ether yet.
Oh.
We have laudanum if I have any in stock, but this is the frontier.
Yeah.
We don't always have any
So
supplies.
She's biting on the leather.
Exactly.
Okay, what's going to happen here?
All right.
I'm almost afraid to ask.
I've applied a tourniquet. I've made this as tight as possible.
This tourniquet.
Right here. And what I want to do is I want to stop the blood from flowing down towards her hands.
Uh-huh.
Once I cut off the blood supply, I've got about 15 minutes, ideally, or less, to do this whole surgery.
Okay, let's get started.
Okay.
Oh!
This is my flesh knife. This would have been the sharp side of the flesh knife. I'm going to come down here, and I'm going to cut all the way through the skin and the muscle, all the way down to the bone. Next, I'm going to take a Caitlin knife. Now, if you imagine that her sleeve here is where I made the incision, I'll use the Caitlin knife to help me push the skin and the muscle up, creating a little window here of just bone. Next.
Oh!
We're going to take our bone saw.
Look at this. And it's not sterilized, is it?
No, they don't sterilize yet because nobody knows about germs. I do wash the blood off sometimes to prevent it from corroding my tool, but that'll be about as clean as it gets.
Oh my gosh, so you're just gonna saw like you're sawing wood.
Exactly like I'm sawing wood. I'm gonna saw right through the bones of the arm. I'm gonna take the hand, I'm gonna chuck it away. Now we've got to close all of the veins and the arteries, otherwise when I remove the tourniquet, she'll bleed out.
Yeah.
For the small blood vessels, I'm going to take a cauterizing iron. This would have been heated red hot. I'm going to burn all the little ones closed. If I have time, I'm going to do something else for the large blood vessels. I'm going to take this tool right here. This is called a tenaculum. I think of the tenaculum as like a fish hook for blood vessels.
Oh my gosh.
I'm going to take this tenaculum. I'm going to insert it into the soft tissue of her arm, hook the large blood vessels, and since I pushed everything up, I'm going to draw these back out just a little ways, tie them off with silk thread or with catgut. At the end, I will take the soft tissue, I will pull it back down. Now the bone ends here, the soft tissue comes down a bit past it. I can make a nice pad out at the end of her arm.
You know, this is almost too much information here.
Well, it's almost done.
Wow, and how many amputations? Would this have been a big thing back in the gold rush?
It was a fairly common thing.
Because of what?
Gangrene. Gangrene is the #1 cause, gangrene and frostbite.
Wow, so you were removing arms and legs and hands and feet.
And fingers and toes.
Without any anesthesia.
No.
Without any sterilized instruments.
Correct.
Boy, I'm glad there's nothing really wrong with me. I've just got a little head.
Well, you've got a head wound there, Huell. Think maybe you want me to have a look at that? I've got some great saws.
This looks like something from the Middle Ages. What have we got here, Kristen?
You have a variety of medical tools, everything from retractors to dental instruments to bullet probes and forceps.
Okay, now what about my head? I've had a bullet.
You have had a bullet injury to the head. To the head, it is probably a flesh wound, otherwise it would have penetrated the skull and the brain and you would be dead.
I'd be dead already.
You would
so
be.
This isn't, there's nothing up there as far as a bullet is concerned. It just grazed me.
Right, it probably just grazed you. You might need some stitches.
But what if I had a bullet in my arm or in my chest?
We would need to get that out.
This gets interesting. Watch this.
Bullets are made of lead.
Look at these bullets down here. These are the actual size of the bullets. Mm-hmm. So you've got a bullet right here in your hand.
I have a bullet made of lead. So lead, it will give you lead poisoning if it's left in the body. A bullet, when you're shot, enters and makes a nice channel until it comes to rest. But your body will swell that closed in an effort not to bleed to death. So now the doctor looking at the end can see where the bullet entered, but doesn't know where the bullet is.
So
we take a bullet probe. That's what this tool is right here.
A bullet probe.
We will take the bullet probe, insert it into the bullet wound, and now we're just basically poking around until we make contact. And then can I ask you to hold that for me?
Yeah.
So we're going to take our bullet forceps.
Oh boy. Look at those
things. These guys right
things.
here, bullet forceps.
Uh-huh.
We will run them down the length of the bullet probe until we make contact with the bullet, grab a hold, and pull the whole thing out at once.
Oh boy, that hurts.
Yes, it does.
But at least you got the bullet out.
Exactly.
And all of this had a, boy, I'm a mess with this thing. I sure hope this is doing me some good, but all of this had a purpose to it. Each one of these instruments, as basic and as horrifying as they look, actually served medical purposes back then.
Yes, they did.
Do you ever wonder how anybody lived through going to the doctor or to the hospital?
Yes, I do. Especially considering that nobody understood about germs. Nothing was clean. They didn't realize where the secondary infections were coming from. It's really amazing that people survived.
And I forgot to tell you, I think I have kind of a strep throat.
Oh, dear.
What can you do for me?
Well, that was a little bit grim as well. All right, Huell, here we go.
Oh, I've seen those things over across the way. Look at these things.
Okay. These guys here, these are blistering cups. But the way I'm going to use them to help treat your strep throat, I think that your strep throat is caused because you have too much blood here. That's what's causing the swelling. So we want to take some of this blood out of you.
You're going to bleed me.
I am going to bleed you from the throat, and I want to be careful.
Bleed me from the throat?
Yes. I want to be careful so that I don't nick any of the veins, the big veins and arteries. But I will take a small, this is a combination scalpel lancet. I would make shallow incisions. And then I would heat up the air inside my blistering cup over a candle and put it right on you. As the air inside cools, it's going to start sucking on your skin, and it's going to draw blood out through those incisions.
Well, it sounds bad, but at least that beats leeches.
Well, leeches have their uses as well. Here's one place I want to put a leech where the cup's not going to work. If I was to ask you to open your mouth and give me a great big ah, and I would put a leech in a leech tube that works a lot like this funnel.
You're kidding.
No, I'm not.
You'd put a leech down my throat?
I'd put a leech all the way to the back of your mouth and have him drink off the swollen tissues directly.
I'd rather drink the medicine oil that I had down there.
Oh, I have medicines for you too. One will make you vomit, and the other one will give you a case of the trots. And I'm going to pull the sickness out of you from both ends.
There really were a lot of diseases back then in Gold Rush, California that we don't even know about in today's California, right, Irma?
Yes, they're very seldom noticed because they've practically disappeared from this part of the country. Anyway.
What are we talking about?
Well, let's start with malaria. It was a very devastating disease to the people who lived in, natives who lived in this part of the country. About the time Sutter was developing his fort, some French trappers came down from Fort Vancouver, and they brought malaria into the whole valley system of California. It's a mosquito-transmitted disease, and it took out about 70% of the native population. Really? And that's one of the reasons Sutter had really quite an easy time, because many of the native people were just not there anymore.
So malaria, and then we had cholera?
Then we had cholera that was brought in through Panama by the Gold Rush people, and it came into Sacramento. There'd been epidemics all over the United States, but it came into Sacramento about 1850.
And killed a lot of people.
It killed about 1,000, we estimate, in about 3 weeks' time, in about 1850.
And while we're watching this operation in progress, another disease that hit a lot of people was scurvy.
Yes, the people who were came to Sacramento came on long sea voyages or long overland voyages, and they just didn't have vegetables and fruits that contain vitamin C, and scurvy is a disease caused by the lack of vitamin C, and it's a very serious disease.
See, you never even hear about scurvy today.
I know. 20,000 people were the estimate of those who died on the way here, and when they after they arrived from scurvy. It was the biggest killer.
Coming to California?
Coming to California.
Is that right?
Yes. It was a tremendous killer. In fact, some people with scurvy and other diseases could not keep up with the wagon train, so they were abandoned on the roadside and left to die.
And if they got to California and got sick, like I am, what were their chances of ever getting well?
Well, first of all, about 1 out of 5 people died within 6 months of their arrival in California.
Wait a minute. 1 out of 5 died after 6 months of living in California?
Right, from the variety of diseases.
Or from the cures.
Or the cures. Of course, you have to realize back then, physicians did not know the cause of disease. Therefore, basically, they treated the patient. Today, we treat the disease.
Okay, before we leave, let's pay tribute to 2 real doctors. Bob, what have we got here? We got pictures of two guys who actually were real doctors and did good work.
We have Dr. Logan, who arrived in the end of 1849, was active taking care of patients during the cholera epidemic. Our first weatherman, he kept such accurate weather records from 1850 to 1870, the National Weather Bureau accepted them.
But wait a minute, what does weather have to do with being a doctor?
Well, he felt that the weather and other climate things were related to the variety of diseases. So he kept actual records of morbidity, mortality, and all things that he thought might be related to disease.
He was a real doctor, and then this other one is...
Another real doctor, and he, along with Dr. Logan, are probably our two most prominent early doctors. Dr. John Morris, he was at Sutter's Fort here for a while. He was involved in a lot of medical things. He wrote the first history of Sacramento, published in 1853. He was editor of the Daily Union, and about 15 to 18 other things in addition to medicine that he did.
Well, thank goodness there were some real doctors here in the midst of all this, which brings us up to my head wound, my gunshot wound to the head, and you've got a solution for that. Look at this thing.
Well, if we had to open up your skull, this is the tool that we would use. This is a trepan. This is a saw bit, and it allows me to drill out a piece of your skull.
You would just drill out my skull?
Correct.
And do what?
Generally, I wouldn't perform this surgery unless you were already unconscious. But then what I would do is I would be relieving blood pressure that was pushing on your brain, keeping you unconscious. But that's the tool I would use to open you up, and then I would close up the hole with a silver coin. That had been
put the silver coin in my skull?
Yes, I would. Silver will not react badly with the body's tissues. It won't be rejected, and it will close over that hole.
It's a wonder anybody lived. I tell you what, I've still got my gunshot wound to the head. I'm still feeling poorly, even though I've been drinking a lot of your snake oil. The hand is actually feeling pretty good with this. What do you call this thing?
A poultice, sir.
A poultice. It's kind of smells like a salad.
It's got sage and vinegar in it, sir.
Yeah, so it's a kind of a salad potent here.
I suddenly feel the need for spaghetti.
Yeah, no, there is a definite odor coming off of this thing. But
could be the gangrene.
Could be the gangrene.
We haven't opened it up yet.
Well, you know what? This has been really interesting, and whenever anybody in today's California starts complaining or making comments about the healthcare situation in California, all you got to do is think back to 1850, and things seem pretty darn good all of a sudden, don't they?
You're darn right. Sutter Hospital across the way is a lot more advanced than we were.
Absolutely.
But they are sitting on our property. Their history goes back to this very fort, medical care, right back to the 1840s.
Well, we took it back about as far as you can take it in California. This has been so interesting. We've had a lot of fun with it, but I think we've opened up a lot of eyes to just what medical care meant, what it was in those early wild and woolly days back during the gold rush here in California. I hope you've learned as much as I have today. We've had an absolutely amazing day here at Sutter's Fort, going back in time to gold rush medicine. All of it, well, most of it, very much a part of California's gold. Let's give everybody a wave. We've had a wonderful time here at the fort, and I'm feeling better already. Ah, good old gold rush medicine. It's a wonder anybody survived. And if you'd like to see this episode again, share it with family or friends, or more importantly, donate a copy to your local school or library. It's available on video cassette and on DVD. All you have to do is call 1-800-266-5727, and we'll be glad to send it to you right away.